Stomach pain in traditional Chinese medicine is analogous to various conditions in Western medicine, such as acute and chronic gastritis, gastric ulcers, duodenal ulcers, functional dyspepsia, and prolapse of the gastric mucosa. It is caused by external pathogens, dietary issues, emotional disturbances, etc., leading to stagnation of stomach qi, disharmony in the stomach's descending function, and pain due to obstruction. In diagnosing stomach diseases, it's crucial to differentiate between deficiency and excess, as well as cold and heat. Most cases are caused by cold pathogens. Excess conditions usually present with severe, fixed pain that is aggravated on pressure and a strong pulse. Deficiency conditions have a milder, non-specific pain that is relieved by pressure and a weak pulse. Pain that lessens with warmth indicates a cold pattern, while pain that lessens with cold indicates a heat pattern. Generally, early-stage disease affects qi, while chronic disease affects the blood. Treatment focuses on regulating qi, harmonizing the stomach, and relieving pain. For excess conditions, differentiate between cold congealment, qi stagnation, food stagnation, heat congestion, and blood stasis, and apply treatments like dispelling cold and relieving pain, soothing the liver and resolving depression, digesting food and guiding stagnation, clearing the liver and stomach, and promoting blood circulation to remove blood stasis. For deficiency conditions, distinguish between cold deficiency and yin deficiency and use treatments to warm the stomach and strengthen the middle or nourish yin and benefit the stomach. In clinical practice, when liver dispersing functions normally, qi flows smoothly and the stomach will be harmonious and calm. This is what is meant by treating the liver to pacify the stomach. Chronic stomach diseases often involve accumulation. Treatment should emphasize methods of promoting blood circulation and removing blood stasis. Fullness and stomach pain. Both conditions are located in the epigastric region and often appear together. Stomach pain is primarily characterized by pain and usually begins suddenly. Fullness is primarily characterized by a feeling of fullness and bloating, with a slower onset and no pain on pressure. The treatment methods for both are similar. There are some difference between stomach pain and abdominal pain. Abdominal pain refers to pain occurring below the epigastrium and above the pubic hairline. The abdomen is divided into the upper abdomen, lower abdomen, and hypogastrium. The upper abdomen, above the navel, belongs to the spleen and stomach and is governed by the channels of the spleen meridian of foot Taiyin and the stomach meridian of foot Yangming. The lower abdomen, below the navel, pertains to the kidneys, large and small intestines, bladder, and uterus, and is governed by the channels of the kidney meridian of foot Shaoyin, the large intestine meridian of hand Yangming, the bladder meridian of foot Taiyang, and the Chong and Ren meridians. The hypogastrium on both sides of the lower abdomen belongs to the liver and gallbladder, governed by the liver meridian of foot Juayin and the gallbladder meridian of foot Shaoyang. Abdominal pain is a common clinical symptom and can be caused by various factors. External pathogenic factors such as wind, cold, summer heat, dampness, dietary factors, emotional disturbances, and constitutional yang deficiency can all lead to abdominal pain. The main pathogenic mechanisms include cold congealment, heat congestion, food stagnation, qi stagnation, and blood stasis. Treatment principles focus on unblocking. Treat excess patterns by purging, deficiency patterns by tonifying, heat patterns by cooling, cold patterns by warming, and stagnation by promoting flow. In some cases, a combination of cooling and warming methods or purging and tonifying methods is applied. In clinical practice, a doctor shall flexibly apply the method of warming and unblocking. This method primarily uses acrid warm or acrid hot herbs combined with qi-regulating herbs and is complemented by yin-nourishing and blood-tonifying herbs, as well as herbs that promote blood circulation and remove stasis, and sweet and mild qi-tonifying herbs. We need to understand that the abdominal pain in dysentery often accompanies tenesmus, diarrhea with red and white pus and blood. Gynecological abdominal pain often occurs in the lower abdomen.